So hello and welcome. This is a webinar, Ask the Doctor of Physics. Just to give an introduction, Amatec Land has an extensive heritage in temperature measurement, including a wealth of innovation that stretches back to just after the war in 1947. Designed and manufactured in our HQ in the UK, in Dronfield, just outside of Sheffield, in the middle of the UK. Market-leading technology is supported by world-leading calibration facilities. That gives accuracy of measurement that we will cover during this webinar, which is a key to effective temperature screening for human body temperature measurement. As well as our extensive history innovating in non-contact temperature measurement, we also have extensive history in human body temperature measurement, stretching back to the original SARS epidemic in 2002, when we successfully helped contain and control the disease. During that period, we patented an important technology known as in-scene calibration, which we'll cover a little further as we move through this presentation. There's so far over 1,000 human body temperature viral alert systems installed globally. So we are not new to this area of expertise. We've been leading innovation for many decades. COVID presents a major challenge for economies looking to reopen and remain open without causing resurging spikes of infection. Along with social distancing, hand hygiene, face coverings, temperature screening can also play a vital part in mitigating the spread of the disease. The caveat to that is if it's implemented appropriately. There are a wide raft of new providers that have entered this market space, making a large number of claims. And today, with Fiona's expertise, we're going to examine some of those and identify what an effective temperature screening system looks like. So, just covering some of the mitigation methods. Face masks and coverings. There's none of the mitigation methods that are 100% will prevent the transmission of COVID. However, the more risk mitigation methods that are implemented, the greater resilience a facility and organisation will benefit from. So face masks and coverings, they can reduce the risk of transmission if they're worn correctly. However, they can be uncomfortable, they can be impractical. The one size fits all is often less than optimum. Indeed, they can increase contagion risk if they're not treated in a thoroughly clinical manner. Moving on to the next risk mitigation measure, hand hygiene. This only lasts as long until you touch a potential area of infection, such as your eyes, nose or mouth. And according to the WHO, the World Health Organization, the virus can be very resilient, remaining infectious for periods between 2 hours and 9 days. It's a very resilient virus. So maintaining a sanitized environment can be very onerous in high traffic areas and difficult to sustain. Social distancing. Guidance varies by country. Many countries have implemented an initial 2 metre social distancing, with some opting for 1 metre. Looking into the research around this, I think some of the published papers that were published in The Lancet gives an indication that infection rates can drop dramatically with increasing distance. And I believe this is part of the advice which has been incorporated into the social distancing. However, as more and more of the economy opens up, maintaining strict social distancing can be very difficult. Getting a haircut, playing sports, along with lots of other activities, including those within the health sector, can be very difficult to maintain social distancing at all times. So at that point, I'd like to introduce Dr. Fiona Turner, our expert in temperature measurement, to help us understand some of the benefits and limitations of temperature screening. Hello, Fiona.
Hi, Chris. Hello, everybody.
So, Fiona, we've been asked a few questions prior to the event, which I think are quite common questions that we come across in the market. So, first of all, I think one of the key areas that's often adopted as a first attempt at temperature screening is the use of non-contact handheld thermometers. So I was wondering if you could just take us through some of the benefits and limitations of using handheld thermometers for temperature screening purposes.
Okay, this isn't a route that Land decided to go down into the markets ourselves, but there's two types. There's the handheld that the medical professionals use. It measures right inside your ear cavity, very reliable. The advantage of them is that it's measuring in the same place each time. But the big disadvantage is how close somebody has to get to do that, a little amount of time that it takes as well. But the next step is to have the non-contact one that could be used from a distance. So the operator could preserve social distancing. However, the operator is introducing quite a big error factor because different operators, we've seen this in our more normal fields of operation where we work in glass milk tanks and metals sites. We see that different operators produce a different temperature measurement, and that's because they tend to focus on a different point. So if somebody measures on your forehead and then the next operator measures on your nose, you might get a difference of about 5 degrees, which isn't helpful. That means that some people might be allowed into the building who are actually feverish at the time. So we prefer to remove the operator from the equation, both from the fact that they can introduce an operator-specific slant to the measurements, and also because that operator themselves is in danger of contracting the virus from close proximity with everybody who comes into the building. And then if there is somebody who's infected, potentially that operator would then be passing it on to the rest of the staff.
That makes sense. So the mitigation method that you're trying to implement, you're violating one of the other mitigation methods to implement it, which doesn't make sense.
Yes, so that isn't the route we've headed down ourselves.
Okay, can you talk to us? I see lots of claims regarding some of the handhelds regarding accuracy. So you've highlighted there that there's operator variance, but what about the actual accuracy of the units themselves? Could you give us any commentary there?
Well, I don't know the spec sheet of all the different competitors' instruments. The ear thermometers, I believe the best is 0.3 of a degree C. Anybody who claims more than that, really, you can't. How are you going? You've got to have that measurement traceable back to national standards.
Yes.
Of reliability. I couldn't believe anything that was better than 0.3 degrees. And the pyrometers that are used from a greater distance, a few degrees potentially. We can't make anything that's better than plus or minus 2 degrees. And that would be to be used from a fixed distance on a target of a known metal. So I doubt anybody would be able to achieve better than that, measuring off a face.
So in terms of the overall accuracy of the units, you're already challenged in terms of being able to accurately identify elevated temperatures. So you could end up with false positives and negatives.
Yes.
People entering a facility that have a high temperature, but the instrument's reading low. Or equally stopping people that are quite healthy from going about their business because you've got an alarm setting. Does that summarise things?
Absolutely, yes. The alarm setting, really you need to be sensitive to less than 1 degree to determine between a healthy person who runs warm and on a warm day and a feverish person.
Thank you. So just moving on now, Fiona, the other end of the scale, and one of the questions that we're often asked about, this is typically in areas where there's a high footfall, a high volume of people entering of facilities. Can you give us some comment around the higher resolution crowd scanning, multi-person thermal imaging solutions and how suitable they are for temperature screening?
You've asked me another question about the products we don't make ourselves. This is another route that we decided not to go down. We do make high resolution, wide field of view thermal images for other applications, but not for this application. We wouldn't recommend it. because of the variations within the scene. With any wide-angle thermal imager, you do measure slightly different temperatures at different distances. It's impossible to screen that broad angle of view so precisely that you can measure exactly the same temperature at different distances. So that you might introduce a correction algorithm, but at the same time, in crowd scanning, it is a very difficult thing to have a correction algorithm that would work perfectly for a face that appears large in your frame because they're close to the camera, and another face that's very small in the distance and off to one side. So that's one of the big challenges. And then the other challenge is that these are normally situated, the cameras might be situated up on the ceiling. Somebody with quite a lot of hair on the top of their head is going to appear a lot cooler than somebody who has rather less hair on the top of their heads. So for various reasons, we haven't gone down that route. Also, for the throughput of people that they can cope with, you could just have more simpler systems, because the price to get a good crowd scanning system, the price goes up with the number of pixels in your thermal image.
Okay.
And so it isn't even the most economic solution.
Okay, so part of the challenge with multi-person and crowd scanning is that variability in real-world environments and the ability of the software to definitively judge your distance, because I think part of the issue from our previous conversations is the closer you are to a thermal imager, the hotter you can appear unless it's properly corrected and calibrated. Is that correct?
Yes, and that would be very difficult to do for all angles of the image, for people with more and less hair concealing their faces. Yeah.
Okay. And just to add to that, I think the fundamental physics behind that is indeed why the FDA has issued guidance that this is not a recommended technique because of the variability in real-world installations. So we've covered two techniques there. Again, to all the attendees, if you look to the right hand of your screen, there is a section for questions. If you've got any questions, please put your questions in there, and we'll answer those a little further on in the webinar. Just moving on now, we've covered two questions that have been asked prior to the webinar about handhelds, and also covered multi-person and crowd scanning. We're now moving on to single person thermal screening, and a key point to note here is about an integrated black body source. So could you explain a little bit to us about what a black body source is, Fiona, and what the importance is with reference to human body temperature measurement?
Okay, well, a black body is a perfect radiator. We all emit radiation. Every warm object emits radiation in line with Planck's law, Max Planck. I think about 1903 this was established. But a true black body follows that law perfectly, whereas all real objects don't emit the full amount of their radiation according to their temperature. So a black body is something that behaves like it should do, certainly. So what the system that we do recommend for the temperature screening of people uses a small black body source within the image to be used as a comparison against the face of the person.
Okay.
Does that answer your question?
Yeah, so I think in our prior discussions we discussed that the amount of energy emitted by a human body is much less than we would typically see in a steel plant or a glass melt tank.
Absolutely.
So it makes it a real challenge when you're looking to definitively measure a temperature in changing ambient conditions. And I think with the lower energy emitted by the human body, and particularly when you're measuring just the face, can make it a real challenge. So what I've understood is the integration, if a black body is integrated properly within the software, it can run a real-time calibration to check it's got a known temperature from the black body within the scene, and then if it's measuring at a fixed distance, which a single person system can, you're taking a lot of the variability out and a lot of the problems that you would have with crowd scanning or multi-person scanning to give you that accuracy and reliability.
Yes, everything you said is absolutely correct. You've missed out the bit about wavelength though.
Okay.
That's
why I brought the doctor and the physicist
yes.
with me.
While we do emit an awful lot less energy than the glass meltdown, which runs at 1500 degrees C, it's still easy enough to detect in the infrared by using a longer wavelength detector.
Okay.
So it's not that we can't see it. It's not that there's a very dim source. That isn't really the problem addressed by the black body. It's merely the precision, as you say, and having the reference and the real-time calibration, which means that our system can be more accurate. So without the black body in the scene, I think our thermal imaging system would be plus or minus a couple of degrees. But with that black body, it's 0.3 of a degree C.
Okay, thank you.
Because we can control that black body very, very tightly.
Okay.
And then the face, as you've already said, is measured relative to the black body source.
Thank you. So that's a little bit more understanding of the fundamental physics. Just examining some of the other features that we have built into this system, can you talk a little bit about face detection?
Right. Well, there's different algorithms. A lot of people are doing face recognition. We're only doing face detection so that there's no problems with data and unlawfully taking people's photographs and storing them. So we're just using it to recognize that this is a face. And then within that face, we can use the hottest pixels in certain areas. The forehead is a good place to measure. As I said before, the nose tends to be significantly colder. So we'd avoid that area. So that's all we use the face detection for.
Just one of the, in terms of the face detection, so one of the issues with a number of systems is inadvertent readings.
Oh,
so
of course.
if somebody was to walk into a scene in one of the high resolution scanners with a hot drink as they come into work.
Yeah, if you didn't have face detection, yes, you could set it off with any hot item. Yeah.
So I suppose the face detection does two things. It gives the automation so that you don't need somebody in contact and you can maintain the social distance. And then is an error checking tool as well to make sure that you're measuring a face and not a hot coffee cup or something.
Error avoidance.
Error avoidance.
Say.
Yes, thank you. Okay. So just to sum that up, in terms of an ideal system for human body temperature measurement, because of the very low levels of energy and because of the potential for error readings and variances in the ambient environment, integration of a black body at a known fixed distance to the measurement subject is a way to get reliable and repeatable results.
Absolutely, yes. The problem with the human body temperature screening is the precision measurement you require. The difference between a healthy person and a feverish person is so small that really you're trying to get every last 0.1 of a degree of accuracy out of the system. So that's where our patented black body reference source comes in.
Thank you. So just moving on, and to highlight the new product that we're bringing to market, I was wondering if you could just talk us through some of the aspects of the Viral Alert 3 again, Fiona, the key elements that have been incorporated into this product to make it as reliable, repeatable, and as accurate as possible.
Well, we could do a little demonstration. We have a Viral Alert just over here, if the camera could see as they come over. So I'm approaching the system now. You can see there's a yellow box that has detected my face in the visible image. I hope I'm not standing in the way of the other camera. It's already worked. Within a couple of seconds, I got a pass, so the outside of it gone green. You can also see my thermal image in the small inset in that. So this area is the thermal image, and the person is identified in the main section of the screen. Did I get in the way of the camera?
You didn't. We managed to see that, but could I just ask you to do that again to just show the attendees the speed of response?
Yellow box, face detection. There's calculating now pass.
So we've got a reading time there of typically less than 2 seconds. So as you were saying, where there's a challenge in terms of high footfall, the cost point for this compared to a high resolution imager would mean that you could have multiple systems.
Oh yes, I'd have thought so. Even if you've got a football crowd, have them going through little gates, little tracks, and having to walk past a viral end at a fixed distance.
Okay, thank you. Yeah. So just to recap on some of those features, the Viral Alert 3 utilises face detection to ensure accuracy, that we're measuring a face and eliminate false readings. It doesn't use facial recognition, which has privacy issues typically associated with it. To get the recognition algorithms working properly typically requires cloud support, which can cause privacy issues. And the system's been designed to be simple and intuitive, green for go, red for alert, backed up by customizable text on the system. And the system can be integrated with door access, clock systems, time and attendance systems to automate the process. So here we have a little bit of footage that might be able to easier for you guys to see. This is a short clip from our reception here at Landing in the UK. Fiona, could you just talk us through this as the video plays, please? It should be. There we go.
Oh, I recognise him. Right, there is the yellow box, but you do have to remove your mask. So there's the identification time and a pass, fortunately. Second person. Now, I know this lady is significantly shorter than the first chap, but again, the system automatically identified the face.
So we've got a good vertical field of view there to account for different heights of people coming through. As you said, the variance in heights there is from just less than, I think, 5 foot to over about 6'3".
Yes, yes. Another taller person coming in now. And another pass. I don't know whether you can call anybody feverish.
Yes, just to let our
somebody with a beard.
Yes, I just want to clarify, we have simulated a high temperature here. The gentleman just walking up to the camera has simulated a high temperature. He wasn't harmed in the filming of this clip, I can assure you, just to show you the positive results. So there you saw very clearly the screen highlights red, and it indicates that a high temperature is being detected. Here's Fiona being measured. Yes, she's good to go. So I think what you can see from that is that the software has the area detection built into it, and that the reading process and measurement process is straightforward and simple. The system can be customized to suit your requirements. The text that you can see in the bottom left hand of the screen can be customized to suit your message. So should it be a case that should a positive reading occur and they need to contact a specific extension number if it's an unmanned reception, or if there's other instructions you wish to put in there, that's all facilitated within the design of the software. So I think that brings us to the end of the webinar today. If there are any further questions, we'll look to address those now. Just bear with me and I'll see if we've had a question submitted. So one of the questions that we're being asked is what sort of time is required for somebody to regulate their temperature if they've been exercising, or should they have sunburn or been out in the sun? I've actually done some real world testing, so I'll just comment on the sun. We've visited an installation recently. We've had some unusually hot weather in the UK over the summer for at least 2 or 3 days. Now, during that time, there was a number of members for a local sports club that were coming in after being out in the sun for a significant period. What I can say to you is when they walked straight into the system, it would detect a high temperature. If they moved away from the system and waited for literally 30 seconds and then came back to the system measured normally. So I think in terms of that question, if I could ask you to perhaps comment a little bit on exercise, Fiona?
The 30 seconds sounds reasonable. Yes, your skin temperature does go up, and your body temperature might go up a little bit, but your skin temperature would often go up a little bit more because that's the way the body tries to cool itself. But that does react fairly quickly. So 30 seconds sounds as long as you would have to wait, I'd have thought. But we are offering a temperature screening product as well. I should perhaps say, if somebody did fail, there would normally be a further investigation, maybe involving an ear thermometer.
Okay.
That's a medical kind of level.
Well, seeing as our audience is the healthcare market today, Fiona, I think perhaps it'd be worthwhile to just go through what we'd recommend as a procedure. So this would be a first line screening system.
Absolutely.
That
yes.
You can maintain.
Quickly checks everybody as they come in. Not just the key workers, but the delivery people, somebody who's just passing through. You can just quickly screen anybody who comes into your facility.
And should you have an elevated reading, you can allow them 30 seconds or a minute to perhaps cool down.
Yes, it possibly depends where the unit is situated. If somebody has been walking around within an office temperature, then they shouldn't have an elevated temperature unless they're feverish. Yes. So I don't want to always say, give them a minute or two to cool down. It depends where it's situated. If you know that it's a hot day outside and people are in the hot country and people are coming straight in through the door and there's the measurement system, then it would be advisable to let people have a moment in the cooler atmosphere.
So if they were to be highlighted and alerted as a risk, what we would recommend is that as a final check, a tympanic or an in-ear thermometer is used to make the final validation.
Yes, but there is also the option to be tracking the data that you've got of previous people's temperatures. So if everybody is coming in a degree hotter in the summer, you will see that everybody comes in a little bit hotter than in the depths of winter in a cold place. So you may want to adjust your alarm level. The administrator of the system may want to do that if people are being measured just as they enter a building.
Okay, thank you.
So it is only the odd person who has a standout measurement who will be rejected.
Thank you very much for your time. Unless there are any further questions, I'm going to draw the webinar to a close. Thank you very much. You will have the information sent to you shortly. If you do have any further questions, please feel free to get in touch. We'd be more than happy to address those on an individual basis. Thank you.
Thank you.